I received a call recently from one of my client's daughters, and she was upset because mom received a hospital bill for over $800. I could tell she immediately thought, man, just another one of those insurance guys ripped my mom off. After we talked briefly, she quickly changed her mind. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm going to break down the cost differences between Medicare Advantage, which is Part C, and Medicare Supplements, which are Medigap plans, over a 25-year period. And this recent conversation I had with my client's daughter really inspired me to do this video so that you guys could see how the numbers break down over a long period of time. So I'm going to go over three basic topics today. Number one, I'm going to give you the real quick backstory of what exactly happened to my client. Number two, I'm going to tell you briefly how these plans work in terms of monthly costs when it comes to Advantage and Supplement. And then thirdly, we're going to deep dive a 25-year analysis of how much those plans would cost on average. And that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this content helpful. I really do appreciate you doing that. Okay, so let me give you a quick backstory of what actually happened. So my client, we'll call her Betty for illustrative purposes. Betty has been on a Medicare Advantage plan since she was Medicare eligible. Now, because she's 91, she was Medicare eligible back in the early 2000s. So she never had a Medicare supplement. She's always had original Medicare and a drug plan, or original Medicare and then replace that with Medicare Advantage. But she's never paid for a Medigap plan. She has gone 26 years from 65 to 91, and she's been very healthy. She's been a very capable person, especially for somebody in her early 90s. Very self-sufficient, lives alone, very few doctor visits. Now, I go over every year and review her plan. She has siblings that are my clients, and I remember her telling me, well, why don't I get a monthly food card? Why don't I get this grocery benefit? And I would always tell her, I'd say, Betty, you don't want to change this plan for groceries because you have a really strong medical benefit. And then bang, a month ago, I get a call from her daughter. She was hospitalized. Since she never really used her plan because she'd been so healthy, she didn't know what to expect. So when she got an $800 bill, she didn't know what was going on because I'd always told her she should keep this Medicare Advantage plan. So that's the backstory to how we got here right now. So when Betty's daughter called me, I listened to what she had said. She said she got a bill for roughly $800 for a hospital stay. And I asked Betty's daughter, I said, do you know what Betty pays a month for her plan? And she said, well, over $200 a month. And I said, no, she pays for Medicare Part B, which is $185 a month. But that only gives you 80% coverage. So Betty was only paying an additional $29 every month for her Medicare Advantage plan. So $29 a month is what she was paying on top of her Medicare premium, which only gave her 80% coverage. And for 3 nights in the hospital, her hospital bill, the entire thing she owed, was $825. And the reason is because the Advantage plan I have her on, it's one of the lowest hospital co-pays in Ohio. Her plan charges $275 per night, nights 1 through 5. So she was responsible for $275, $275. So of an entire hospital stay, I mean, I'm talking $30,000, $40,000, $50,000, $60,000, I'm sure that bill was, her responsibility was $825. Now, I explained to Betty's daughter, if you want that hospital stay paid at 100%, your mom would have had to purchase a Medigap plan. And the Medigap plan that was most popular when Betty turned 65 was the Medigap Plan F. So to keep things simple, if she wanted to avoid That $800 hospital bill, she would have had to pay for a Plan F for 26 years. Now, according to the Kaiser Family Foundation, an average Plan F over that duration is $227 a month. So for Betty to avoid an $800 bill, she would have had to pay $59,650 in premiums the past 26 years. So to get that hospital stay with no bill would have cost her $60,000 in annual premiums over the past 2 decades. So once I explained the only way to get that hospital bill for zero is to buy a Medigap plan, she immediately loved me, realizing that her mom had not been paying $227 a month, which is over $3,000 a year. She had not been paying those premiums the last 26 years. Instead, she was saving all of that money every month. And because she was on a Medicare Advantage plan, she wasn't paying premiums for a supplement. And now she had her hospital stay, and her entire responsibility was less than 3 months on a Plan F would have cost her, or roughly about the same. The Plan F was $227 a month. Her hospital copay was only $275 a day. So guys, as you could see now from this chart on the screen, she is operating under the left-hand side, Medicare Advantage. And if we assume her monthly premium was $29 a month for the past 26 years, instead of her paying $227 a month the past 26 years, so she would have paid $68,350 in premiums on the Plan F, where on her Medicare Advantage, in that same duration, she only paid $8,700. So again, to get that bill paid in full, she would have paid $60,000 extra dollars the past 25 years. Okay, now let's talk about what these two plans cover really briefly. Okay, so let's talk about real briefly what these plans cover. So on the left side, the Medicare Advantage plan, which was $29 a month, she was responsible for $275 copay per night at the hospital, but she was only paying $29 a month. On the other side of the chart, the Plan F, she would have paid $227 every month, which is $2,734 a year, but then in turn, she wouldn't have had a hospital bill. But to get no hospital bill, she would have had to pay $2,700 in monthly premiums. And that's illustrated right here on the chart. The left side, Advantage, low premiums, but a copay. Right side, she would have had all those premiums, but no copay. So guys, after having this conversation and after realizing and putting these numbers on paper of how much money Betty saved by not doing a Medicare supplement, it motivated me to do a video that shows you over 25 years what the average that somebody on Medicare Advantage would spend versus the average somebody on Medicare supplement would spend. Okay, so I want to preface my next chart with a few things. So number one is that this is all for illustrative purposes only. The numbers that I show you are estimates and might not be exact, but it certainly gives you a real projection of how things would have went. So all of my sources are linked in the description below. Sources including Medicare.gov, the Kaiser Family Foundation, AHIP, and almost a dozen others are all linked below. So what ChatGPT was able to pull was that if you looked at Ohio HMOs from the year 2000 to 2025, it found that the average maximum out of pocket for an HMO was $4,230. And it also found that during that time, the average premium for a Plan F in Ohio was about $227 a month, which was $2,734 annually. So those are the base numbers that I use for these comparisons. Your maximum out of pocket would be $4,230, and your premium for a Plan F would be $227 a month and 80 cents. So what I did in this illustration was I did a projection. If somebody had spent on average 15% of their max out of pocket, and then I showed if somebody spent 50% of their max out of pocket, and then I show you if somebody would on average spend 75% of their max out of pocket. And we put that side by side with the Plan F to see when you add up the monthly premium and you add up the out-of-pocket costs, which scenario do you come out better over 25 years? Now, a small caveat, the Medicare Advantage numbers, they do not take into account that people on Medicare Advantage get dental, vision, hearing, drug coverage, all these extra benefits. I did not put any of that in this data. Secondly, according to my sources, on average, 5% of people hit their maximum out of pocket. That is it. Only 5% of people get to 100% of spend on a Medicare Advantage plan. So when I use illustrations like they're going to pay 15%, 50%, or 75%, those are very fair expectations because only 5% ever hit 100% of their annual spend. Okay, to further clarify this point, if a Medicare Advantage plan has a $4,000 max out of pocket, but that client spent $2,000 in the year, they would have spent 50% of their maximum out of pocket. If somebody's max out of pocket was $5,000 a year and they spent $2,500 out of pocket, again, they would have spent 50% of their max out of pocket. If somebody's max was $5,000 and they spent $5,000, they would have met 100% of their max out of pocket. So the examples I'm about to go over shows 15%, 50, and then 75. Okay guys, so let's review this chart, and I'm actually just gonna look at my handout as I go through this because there's so much data to consume. So if you look at the top column, if you had paid if you had 15% on average usage, okay, usage of your plan, you would have paid about $634 out of pocket, and then you would have also had $348 in premiums. So you would have spent $982 annually. So if somebody averaged 15% usage over 25 years, they would have paid about $24,000 in healthcare costs. Well, if you go all the way to the bottom of that chart, somebody that had a Medigap Plan F, well, every year they would have paid about $2,700 annually, no more, no less, because they have no out-of-pocket costs. But over 25 years, that same person would have spent $68,000. Okay, let's go look at somebody uses their plan 50% usage on average. So that 50% usage Medicare Advantage would spend about $2,100 in copays, and then again $348 in premiums. So the annual cost would be about $2,463. So even somebody that utilizes 50% of their max out of pocket every year, in the long run, they still would have only paid $61,575. The person with the Plan F is still paying more in the long run. And then their tipping point here, if somebody would hit 75% on average of their Advantage Plan max. Now to do that, you would have to be chronically ill to get to 75% of spend every year on average. You would have to be very, very ill. And in that situation, you would have spent $3,100 a year in copays, $348 a year in premiums, which would be about $3,500 a year total. So in that situation, you would have paid $88,000 over 25 years. So if your plan usage is above 60%, you will pay more long-term than the Medicare supplement. But if your plan usage on average was 60% or less, you are saving money on Medicare Advantage over Medicare Supplement if you do this in a long run table where you're taking everything into account. And again, the side note is, even if you use 75%, you still got dental, vision, hearing, and prescriptions in this plan for 25 years. Where on the supplement, you would have been paying for those things separately for 25 years. And I did not put any of that data in this chart. So guys, this data is very, very clear. Regardless of your opinion on Medicare Advantage, whether you like prior authorizations, whether you like networks, regardless of your opinion, the data is clear. If you are not hitting 60% of your max out of pocket every year, then you are probably going to save money on a Medicare Advantage plan over a Medigap plan. But it's not always about saving money. Okay, I have clients that they don't care about saving money. They want coverage with no prior authorizations, with no networks, and supplements are perfect for those people. But I really wanted to put this data in a chart so you guys can visualize how much money people on supplements, how much money they really pay over 25 years. Because what I hear all the time from people that have supplements is they say, well, I don't pay when I go to the hospital. I don't pay when I have a surgery. And that's not true. You might not pay at the time of service, but you're paying over $2,700 a year to not have to pay when you go to the hospital. So guys, to conclude, I am so happy I have kept Betty on a Medicare Advantage plan for all these years. In fact, when she got her first bill in years, she was so shocked because she was so healthy, she didn't normally get bills. But that bill she got for the hospital, she would have paid more than that bill in just 4 months of premiums on her Medicare supplement. And if you look at the duration of 25 years at how much Betty has saved by not purchasing a Medicare supplement, we're talking 50, 60 thousands of dollars. I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group. Thanks.